there's not a system in our body, there's not a process in our body or none of our biochemistry that happens in the absence of oxygen. And we need to keep things moving for the purpose of drawing oxygen into our body effectively. At the same time, if something stops moving, it's dead. Welcome to the True Health Solutions podcast. I'm your host, Dr. Lonnie Bagwell, stress, inflammation, and functional health clinician.
And I'm your co-host, Brigitte Spurgeon, metabolism and nutrition expert.
This podcast is where we bring hope, truth, and inspiration for your holistic health journey.
Because the world needs the best version of you.
Hello, and welcome to True Health Solutions podcast. I am your host, Dr. Lonnie Bagwell, here with
Brigitte Spurgeon.
The Brigitte Spurgeon. And before we go any further, Brigitte, check in with everybody. Let them know where you're at.
I am
part of the story here.
Yes. I'm in Portimão, Portugal. So that is the southern coast of Portugal. It is the Algarve area.
Awesome. So now everybody will get their phone out and they'll Google Map looking for where that is. Especially in the U.S., we're known for not knowing our geography very well. Actually, I've had to look up a couple of places where you've been. I'm just confession time.
That's
all right,
cool.
so that's right. I'm learning.
Me too. I've had to look it up too.
Yeah, exactly. Right. So that's awesome. All right, and for our listeners today, we're going to be talking about something that is relevant for absolutely everybody. In fact, it will be under the heading of an essential of health, an essential of being truly healthy. It's something that both Brigitte and I, in our very different and respective backgrounds, have intimate relationship with. And what we're talking about today is movement. Is really, if I was going to have one umbrella, as it pertains to exercise, pre-post exercise, and really just movement for everybody at all times. That was kind of, I guess, the umbrella of today, right? We're going to talk anything and everything to do with movement. And so Brigitte obviously has a background in endurance sports, and a big umbrella of all the things that fall under that. And then mine is more the opposite, energy systems. It's more based on power and definitely not endurance. That's not part of my background. I participated in a couple of endurance things in my life, but you can count those on one hand. So we have a pretty good working knowledge of exercise physiology, fitness, those types of things from education and experience. And so we're just going to walk and talk through some of those aspects today that are relevant to absolutely everybody that's listening. Because the bottom line is that there's not a system in our body, there's not a process in our body or none of our biochemistry that happens in the absence of oxygen, and we need to keep things moving for the purpose of drawing oxygen into our body effectively. At the same time, if something stops moving, it's dead. And that sounds obvious to a human, right? But also even our cells need to be healthy, and if they stop vibrating at their specific frequency, it's a podcast for a different topic, but each of our cells vibrate at different frequencies. And so if they stop vibrating or slow down, then it becomes a diseased state of that cell. And if it continues to degrade and move less, then eventually that cell dies, and that cell makes up organs, cells, tissues, and glands. And obviously that's our body as a whole. And so movement is necessary at a microscopic level and a macroscopic level. So with that said, Brigitte, kind of lead us in this discussion today, because this was, I know, a lot of some thoughts that were bouncing around your mind. And as you're working with different clients, you're kind of tackling different phases of their life, different activity levels, different busyness levels, all that stuff, right? All the stuff we deal with every day. So talk to us a little bit more about what you were thinking when it comes to movement.
Yeah, so traveling, being outside of the U.S. for the last several months, I've become keenly aware of the sedentary lifestyle that perpetuates corporate America and really just an American or Western lifestyle. So, a lot of my patients are talking about, sitting at a desk for 8 to 12 hours a day. And then what do? You get in your car and you commute, and then you're at home and you're tired. So you're sitting on the couch talking to a spouse or watching a TV show. And so it's like our day very easily doesn't lend itself to a lot of movement. And as I've been traveling, I've just noticed that it's very different in other countries, because I know Sandy and I, we don't have a car traveling, so we walk everywhere. So there's a lot of walking and movement. And, if we're staying on the 5th floor, we're walking up and down stairs, all day long. So I've been keenly aware of the differences in different cultures. But also for me personally, coming from a background of endurance training where I have objectives that each week I'm training for, and, certainly have times in my past where I may have exercised 2 to 3 hours a day of organized activity. And now when I'm not training for something, what is my focus, and how do I keep healthy, and how do I focus on what's important for my health and longevity when I don't have, a marathon or a triathlon or a mountain to climb or something. So I just had, and, I love having these conversations with Dr. Bagwell and like, well, what are the good things for me to focus on a daily basis? Is it, spinal mobility, stretching, strength, cardiovascular, and what does that look like on a daily basis? So I thought this would be a great conversation for us to have publicly.
Yeah, and it's one that we don't talk about as much when there's I guess disease-based, pathology-based discussions that we're having, right? Or the sexy conversations around caffeine and coffee and addictions and such, right? Hormones. And this is almost like it's so foundational that we almost miss it, right? And I'll tell just very brief kind of perspective from me on this is that, I did, because I was so much in organized sports, when that was done for me, right, and I was no longer on a competitive team or whatever, I really was lost for a long time. I mean, I went back in the gym. I kind of did what I remember doing, but even as I was doing it, I remember this is many years ago before the big functional fitness movement and high intensity interval training came about. And I was pretty lost. I was just doing things, and I was like, I don't really need to do hack squats anymore because that doesn't serve me. That was specifically for being an offensive lineman, and I didn't, I had to find my way. So I became a trainer for the purpose, just like I became a doctor for the purpose of helping my family be sick, stop being sick, and be healthy, and live to see, my parents be able to see my grandkids and all that. I became a trainer because I was like, I want to exercise, and I've done a lot of exercising, but I have no idea what to do. So I went and got certified. Then I would know what to do, and then I started building.
Too.
Right, same thing, right? And so it was selfish, and then I ended up becoming a trainer for other people, and I had to take a bunch of them through it. So that was my foundation for what I would say is the most applicable training type principles that I would apply to patients, not necessarily athletes, because athletes is maybe a little bit different. But anyway, so the foundation, like I said in the opening, is all about movement, and you hit on spinal mobility, and I think that's just a good place to start. And so, because our movement happens from the smallest level and centrally, above, down, inside out, as we would say, and this is the bonus of specifically spinal mobility, is one, when you have your spine moving properly, now you have a chance for everything that articulates with the spine to move properly. If your spine is not, if that's central to the core of your biomechanics, right, that's essential to everything, all of your movement. If that's moving the way it's supposed to, then your collarbone can articulate out to your shoulder. Then your shoulder has a chance, and your elbow has a chance, and your wrist has a chance to be able to move properly. But if I went in there and I fused, right, the vertebra in my spine, that collarbone, for example, articulates with, that scapula ends up articulating with, there's no way that you can have 100% proper motion of your shoulder. And then people might say, yeah, but I have fusions and my shoulder's been fine. Your body may have adapted to that lack of motion. Your body may have, found ways to compensate for the imbalance in motion. And for now, it might be okay. Right. But at some point, we can predict with pretty high certainty that there's going to be a biomechanical breakdown of movement at the periphery, the joints that come off of that area. And so, and then now the other side of that is that, and this isn't a neurological discussion exclusively for sure, that's a different podcast, but the number one fuel for your nervous system is movement of the spine. So that's been documented in recent years. There's been big research come out on that, where if your spine's moving the way that it's supposed to, then it's giving life to your nervous system. And of course, on this podcast and this office, nervous system reigns supreme. It controls every cell, tissue, organ, gland in the body. So that's the bonus of moving your spine first, is you're actually getting the recruitment of a healthy nervous system. And whenever we talk about movement, that's happening through the musculoskeletal system, which is how I like to say it every time, because people forget the neuro part. Everybody wants to focus on working on a muscle, working on a ligament, healing a muscle, healing a ligament, moving a joint, but they forget, and that's all musculoskeletal, but they forget about it being the neuromusculoskeletal. And if you're missing the neurological piece, then, again, that's where you see things like, I remember as a trainer, we had, we had hitches in our giddy up and butt winks, and they have names for every kind of improper movement. Someone will do a squat and you see their hip kick out to the side, or even just to do an exam with a patient 1 hour ago. It was just simple movement of his head forward and backward, and you could actually see a deviation in his head. His head could not go in a straight line, right? And so there's something neuromusculoskeletal happening even at the small level, of just those couple of joints that were damaged. And ultimately, right on the x-ray, we could identify that quickly. But anyway, so number one thing is focus on core movement out, right? I would say that's the most foundational principle of movement for me.
Well, I would
and recruiting
agree.
of that nervous system.
Yeah, I think it has to be foundational. And it's so interesting that you say that, because, my husband being a physical therapist, he travels with spinal care equipment. Like, we're limited to what we can fit in a suitcase traveling around the world. And what does he have in there? He has a wobble cushion. We did shed our head weights. We were struggling getting head weights through security. So we did leave out, we donated our head weights to someone in Mexico, but we travel with spinal molds. But I would say for spinal mobility, having a wobble cushion, because those are more intentionally designed for spinal mobility versus like an exercise ball. But we have used exercise balls before, and really you can even do it on the side of your hotel room bed. But just getting those lateral movements in, so side to side, front and back, and then getting getting a twisting
rotation.
Getting some rotation. And so good. I feel so good about that, because we can check that box, because that is something that we have focused on. We're intentional about it. And I agree, it all starts there, because if you don't have that proper alignment and you don't have the neurological piece, then literally the other things you do can injure you.
Right. That's exactly right. So number one thing for injury prevention, people get more injured because of neurological interference than they do from muscle imbalances, but the whole world focuses on the musculoskeletal, but they're missing the neuro, right? And so you can see from the explanation we just gave that you're feeding all of that at once when you're focusing on that central mobility. And I was even at so speaking of physical therapists, this reminds me, you've heard the story before, but I was at a certification for mobility, and that was in a room of 100 people. It was at least 100 people, and they were all trainers, CrossFit instructors, therapists, all that stuff. And I was the only chiropractor that I knew of in the whole room. And I recognized at that time, this is several years ago, but I only know what I know, and I don't know everything. That's why I was there, to learn mobility. But he starts off with a quiz for the whole crowd, and he shows two videos, of one of a female, one of a male. And he said they both have the same problem, and the squat they were doing were very different looking, very rigid male, very hypermobile female. And he said, what's the problem? Why aren't they doing the squat properly? And he went around the whole room almost to the end, like out of 105 people, right? He went to like 102 and stopped right before me in the back corner of the room. And everybody got it wrong. They were like tight heel cords and shoulder mobility, and they had every other reason. And he stopped right before me. And at that point, I was getting nervous, because they said so many answers I didn't even know. I was like, I don't know, could be. I don't even know anything about that. And I said, well, if he asks me, I'm just going to say spinal mobility, because that's the only thing I know. Like that, I can say for sure would be an issue. And that's he stopped before he got to me. And then he said, everybody got it wrong. The answer is spinal mobility. And I couldn't believe it. I literally stood up in my chair. I stood up and I was like, yes, like I would have got that right after everybody got it wrong. But it was really the only answer I knew. So, I kind of, but anyway, so the point is that even top physical therapists certifying hundreds of people every weekend in mobility as a whole starts off the whole seminar by saying spinal mobility is key. So if you don't believe us, you can believe him, right? And he's been on Good Morning America and, all the news channels and all the special shows with Dr. Oz and all that good stuff. So anyway, spinal mobility, number one, most important thing. And some other quick things you mentioned, like foam roller certainly is one way that you can help get some spinal mobility and throughout the entire spine, really. If you have spinal home care and specific spinal rehab that's been prescribed for you, of course, that's the best way. Like if you have your molds and things that you're laying on, that would definitely be it. And then something you can YouTube this. It's called 6-way stretching. If you want to get specific to the neck and shoulder area, and it's just simply, it's actually holding your head one way. It's rotating your head towards that direction and doing a stretch. It's rotating your head away from that direction and doing the same stretch, and then you do the opposite side. And what it does, it just addresses the anterior, middle, and posterior portions of the neck. So by the time you're done doing all 6, you've got around the whole neck area. Take that along with your disc, because you're moving that in all 3 planes, forward, backward, side to side, and in rotation. And these are just great things to do, anytime, especially if you sit a lot, which is just about everybody nowadays. We do them a lot around here because we sit less than most, what am I trying to say? We sit less than most careers. I guess we're up here and around and run around a lot, but we still do it. The other thing that I think is important related to this is when do you do it? So timing. So what to do and then when to do it. And this is something that I learned years ago, and it's only continued to reinforce itself over and over again. Because we talk about how injury prevention and having core mobility is really important and neurological control of the muscles. But the other thing is when you do it before or after workout? And when I grew up, and even actually I was getting certified as a trainer, they were barely starting to change this. So even in my lifetime, this has changed dramatically. But we would always stretch before and after. And that's what you stretch before and after workout. And most people don't stretch at all. First of all, let's just say that. Like average person, they run in, they do their workout, and they run out. They do not spend quality time stretching. And so hopefully that changes after this podcast today for everybody listening. But pre-workout, a lot of stretching pre-workout, that's actually being recommended against more and more nowadays, because if you really get too much mobility of your body and you're doing a lot of stretching, then depending on what movement you're about to go do, it can actually set you up for more injuries. And that's what the research has shown, is that if you do too much stretching, just regular, like random stretching, whole body stretching even before workout, now it creates too much mobility where you actually needed things to be a little bit tighter in order to prevent injury in that workout. So they actually are recommending that before a workout, you only do warm-ups within the movement that you're going to do. So if I'm going to go for a run, I might start by walking, obviously similar motion, and then work my way up to my running. You could speak more on this, but, more of my technique, and then into staying in that good technique. Now I'm warm and everything like that, right? If I'm going to go lift weights, for example, if I'm going to bench press, I don't need to do hamstring stretching. Right? I don't need cold stretching. I don't need hamstring stretching. I need to work on shoulder mobility before the workout to make sure that my shoulder can handle the load. Elbow, wrist, right? Definitely cervical, neck, right? Mid and upper back. That's the stuff I'm going to get moving properly, and then I'm going to go under the weight, right? Now, once you've exhausted those muscles and now you have maximum blood flow to the area, right? And running might be more so on the lower half, right? But in the case of the bench press, now I have maximum oxygenation of the tissue. I have inflammation going to the area, bringing all these healthy cells, right? There's healing that's happening now, and I already have that blood flow. It's going to give me more mobility. Now I take advantage of all of that work I just did, and post-workout, I get my mobility gains. Now I can get the extra 2 inches of movement or stretch into my pecs, right? Into my shoulders. And then after I'm done that mobility, I've effectively recovered from the workout. I've helped mobilize all that fluid into the right areas to create more healing of that tissue that I just damaged with my workout. And now I can go into full recovery. We'd get into the conversation around hydration, nutrition, etc. So what any comments about like pre-post workout movement mobility there?
No, I think that's fantastic. So then would you say that, so like I would use the term more dynamic stretching. Would that be, so I know like before running, I would do things like, high knees, butt kicks, hip openers, the
Absolutely.
drill types of things. And I think intuitively, I do like to do the deeper stretching post exercise or post workout.
Yeah.
But so would you say that your spinal care falls then pre workout as part of your prep, because you're priming your nervous system and your discs?
Yeah. And as you're talking there, I'm realizing we kind of missed one explanation that's going to tie all this together and be specific to your answer. So you're already kind of asking questions past it because we already know all this stuff. But the difference between mobility and flexibility, that would be that's the key there. So when we're talking, I keep saying the word mobility over and over again, and I'm just realizing that maybe our listeners and watchers maybe don't know what the difference is. So mobility is speaking to movement of the joint. Flexibility is speaking to the elasticity of the soft tissue, your muscles.
The
Okay.
range.
That's critical understanding. So now this will make more sense for everybody. So before the workouts, like you were just saying, you're working on when you're doing butt kicks and all that kind of stuff, right? Movement prior to, you're not getting extra stretch into your hamstrings and quads. You're getting maybe a little bit of stretch. Like if you kick your butt, like at first it might be a little tight, then that quad might loosen up a little bit, right? But really what you're doing, more important than anything, your hips moving in the joint properly. So you're getting mobility of the hip joint, you're getting mobility of the knee joint, the ankle joint, all the little joints of the feet, right? You're getting tons of good active motion, lubrication of those joints. That's the critical part, without stretching too much of the soft tissue so that those joints go beyond their normal range when you're running, because then that will cause damage, right? Whereas post-workout, you want to maintain mobility but shift to flexibility.
Yep.
Now you're going to do your hamstring stretching and and those bad boys are going to go 2 inches further, right? Because they're
Yep.
so warm, all that fluids there, all that stuff. And same thing in my example. Beforehand, I'm getting shoulder mobility, elbow mobility, wrist mobility, spinal mobility, right? I'm going to get on a foam roller. I'm going to stretch over a Swiss ball, right? That kind of thing. I'm going to hang from a bar maybe before I get under the bench, right? But then afterwards, I'm getting full stretch. Now I'm going to get all that fluid moving in and out nicely, and I'm going to get my gains and my flexibility through those muscles. So that the net difference, because anytime we're working out, we're going to get shortening of the muscles, is going to be the net effect, right? So because that's just going to be a natural result of that run, you're going to get tight afterwards unless you work on some flexibility.
And another word too, that I would focus on pre-workout is activation. So for me, I want to activate my core, and my glutes are normally my main focus, but depending on the workout, it could be hamstring or something, but very, very, because
Yep.
I think we underuse our glutes, but our glutes are designed to be a large, strong muscle. And
That's right.
so if we underuse them, then we're going to strain, overwork other muscles, and that's going to set us up for injury. So for me, I learned this through precision fitness, and so my husband and I both are intentional about activating our glutes even before a long hike or before a run, so that we can engage them when we're doing the movement.
That's perfect. Yep, activate. And the best way to activate, so it's mobility, and then it's activation, and the best way to activate is to do whatever movement you're about to do. So if I'm going to squat, as I'm going to do lunges or whatever, then I'm going to do some air squats before I do squats with weight, right? I might do quarter lunges, to get ready for lunges, that kind of thing. So, yep, absolutely. That's really good. And so when it comes to, just a quick synopsis to catch us up to speed here. So pre-workout mobility, activation, do the activity, and then in your cool down, you're going to get your loose hamstrings and your loose shoulders and all that good stuff, so that they don't tighten down too much. And so now the net stress to your body has been minimized, while the net gain has been maximized through the activity. And because there's less stress, there's less injuries, better recovery, quicker recovery, et cetera, et cetera.
So
Go ahead.
what about the person who says, well, I don't really engage in organized working out or activities. I'm not a runner or a swimmer, or I don't lift weights, but I want to be healthy. I don't really have a lot of time. So on a daily basis, like I believe in incorporating, even if it's micro habits daily, because those will have long-term gains. And so if someone is focused on health and longevity, they want the benefits of the mobility and fitness, if there may be 2 or 3 things that someone could focus on a daily basis that took no longer than 15, 20 minutes, watch, so we've identified spinal care, spinal mobility. That
Mm-hmm.
would be a focus. What would you group into those things that we should be incorporating daily, but if we're not going out running or we're not going to the gym and lifting weights?
So I'm going to say some things, and I'll give explanation real quick. I'm going to say something about mindset. We've already talked about hydration, or kind of alluded to hydration to maintain supple tissue, because dehydration will, even with the best mobility routine, you'll lose that battle eventually if you stay dehydrated. And oxygenation. So let's talk about those things a little bit. But the mindset thing because I'm, as you said that, I'm sitting here remembering that just in the last 2 weeks, I had a conversation about someone who's big into gardening. They don't work out. They work at a school setting, right? So kind of stressful environment, running all over the place, but their stress relief and they do not work out in any capacity, but their stress relief is gardening. And so the explanation that I gave her is that what I'll tell everybody in response to that is, first of all, then it's like you have to think of yourself as a gardening athlete, or if it's corporate America and I don't have time to work out, you're a corporate athlete. You don't get a chance where you don't have to focus on movement and mobility. Like if you're not doing it to some degree, no matter what it is, stay at home mom, you're the homeschool athlete, like you're a teacher athlete. You just have to completely change the mindset that you like mobility is not an option. Because everybody that comes in this office that did not focus on mobility, did not work out, exercise to some degree in their lifetime, all they do is spend the next however many years fighting for freedom. Because you lose your freedom to move. And if you lose your freedom to move, it's almost like this, all of a sudden people get this phobia. It's like, I'm not going to get to go out. I'm not going to get to move. You don't win that battle when everything's arthritic, degenerated, dehydrated, desiccated, all the bad words, right? When that spine comes in and there's just nothing left of it, now we're just managing pain all the time and hoping to God that we can go on the 2-hour trip without having to lay down in my car and, I can still walk when I get there. That sounds extreme, but I'm not talking about 60 and 70-year-olds. We see that in 40-year-olds, right? It just depends on how much damage you've sustained and how much you haven't focused on maintaining your mobility and freedom. Anyway, so that's the mindset. It's for everybody, whether you do it or not. It's still for you. And then we change the mindset, and then it's always the same conversation though. It's the same rules apply that we already talked about. So gardening, what are you going to do? Well, when you garden, you're going to squat down, get on your knees. You're going to be elongating your torso, maybe to reach and, that kind of thing. You're going to be lifting things up that are greater than 15 pounds a lot of times. So you have to think ahead and say, that's your workout. And now I'm going to do mobility in the areas that which is probably total body in that sense, right? Because so what am I going to do? I'm going to do some lunges. I'm going to do some squats. You're kidding me? You're telling 65-year-old women to do squats before they garden? I've said that for 15 years. I've been telling, 65-year-old women to do squats before they go out and garden all day long. That's exactly what you do. And then what do? You do core, you do activation. You definitely need core activation and the thing is that if I have a controlled environment where I work out, it's actually more protective of me because literally the bar changes the dynamics in my favor of protecting me, right? So now if I only activate core and spine, I'm not going to hurt myself doing a squat with a bar. However, if I'm gardening and I squat down, it's almost always, rarely is it ever linear. It's almost always dynamic. So I never squat down perfectly to get in the garden. I do one knee down. I have a twist and a bend. I reach over, I put one arm down and then I have to reach. So it's an extremely complicated movement that's actually happened there biomechanically, right? And so it's more important that you would do your movement and activation, your mobility and activation prior to gardening, as an example. At the office, right? You look, sitting like this for 8 hours or 6.5 out of 8 hours is an endurance sport. You are demanding endurance out of all your core stabilizers, right? And so it's the same thing. So how you would approach some type of endurance activity, right? Those muscles, you're putting a great demand on them for extended periods of time. That's an endurance sport. So mindset, understanding all of those things. And then it's hydration. Again, it doesn't do any good to we've done a whole podcast on hydration, maybe, right? So go back and listen to that podcast so you can understand how to more effectively. But you have to have hydration focus. So if you're not hydrating the tissues, then the joints aren't going to be lubricated. The muscles cannot be restored properly post-workout after you drive all that fluid out, and it needs that fluid to come back in to create healing and get you the gains that you're looking for with your workout. Or if we're talking about the corporate athlete or the teacher that's not working out, it's just going to cause the aches and pains. I tell all the time, and in that episode, I'll summarize it by saying I've seen as much as a 50% reduction in fibromyalgia symptoms when they just hydrate. The muscles feel better when they're hydrated. So just lots of pain reduction right there. Better than Tylenol would work in that scenario or whatever. And then breathing. So part of that conversation around hydration is oxygenation. And so we want to make sure that we're perfusing. Perfusing is actually when you breathe the oxygen in, but then can you perfuse it? Can you get it to the tissue? How good of lung function and pushing oxygen to your blood and blood transporting it to tissue, how good is that process? And so we can actually do things to practice, to improve perfusion, I guess is the idea there. So, and we, of course, in this office teach us, 4-7-8 breathing, which really takes us into kind of like bonus content here when it comes to exercise. The focus for our elite athletes, Olympic athletes, which looks like we're going to be working with more here soon. We got some cool announcements there coming around the corner. And then professional athletes, their focus has gone from their sport to recovery. And so the more that they stimulate their parasympathetic nervous system, the better they rest, digest, and recover, then the better they are when they're stimulating their sympathetic nervous system, which is the dominant, performance. I'm going to tackle my day. I'm going to tackle my sport side of the nervous system. And so, when we hydrate, when we oxygenate properly, and then that actually drives us more so into parasympathetics, which is recovery. So we go into our sport, we go into corporate athlete world, we go into endurance sports, whatever it is, with a recovery mindset, so that I can continue to do this for the decades to come. And the bonus is that you get better digestion and all that stuff out of it. So kind of a long explanation of how I tell patients every single day to approach it. That is that if they say, I'm tight, what do I do? I say, well, what are your activities? And then we get into this exact discussion.
Yeah, I would say if you wanted to get the benefits of exercise without exercise, it's breathing techniques. And so, yeah, we teach the 4-7-8. I've done Wim Hof breathing and really enjoyed it. Sandy and I did that for 3 months leading up to climbing Kilimanjaro, for prep for the altitude, but it also actually helps in the cold. And so I've done it in prep for like polar plunges. And I think that's really, really good. And it's actually nice to measure your gains with that, because you time like how long you can hold your breath. And then box breathing is a simple one too. So those would be the 3 breathing techniques that I would suggest for, we'll pick one. I guess they have different purposes. So, for like 4-7-8 is really good for priming the nervous system, whereas Wim Hof is really good like pre-activity. Like if you want to go and like knock out some push-ups after doing some Wim Hof breathing, you're going to see the gains in your strength or or for a run or something like that. So and then box breathing, that was actually was that created by Navy SEALs maybe, and so that that's designed.
I think a lot of people
stressful.
use that. Yeah, that's more like kind of like more focus, like mental focus and clarity. I think they all do a little bit of all of it, but yeah, that's definitely, because nobody would be able to say that Wim Hof isn't giving you like laser beam focus, because it most definitely does, right? But yes, so you have different kinds that do kind of focus on different things. Yeah, that's awesome. And I was at a continuing education thing this weekend that had nothing to do with oxygen, and yet we spent the whole weekend talking about oxygen. I mean, it wove its way into every discussion. It was a mastering functional blood chemistry, so it was talking about running blood work and how to interpret it from a functional level. And you just kept talking about oxygen all weekend, to the point where I was just sharing with Brigitte beforehand, before this episode, I actually bought a new device to be able to measure continuous O2 saturation while you're sleeping, because it's that important, and there isn't a process in the human body that doesn't require oxygen. But especially when you're putting higher demand on it through exercise, through stress of any kind, not just exercise. And if you want proper again, prep before the workout and recovery afterwards, again, there's a high demand for proper oxygenation and perfusion. Awesome. Well, I think that's going to wrap us up for today with this episode on movement, mobility for everybody. I mean, honestly, really, we talked more today about, movement, mobility, exercise at the most foundational level for every single human. And then maybe in future episodes, if people wanted to, we can get into more performance. And obviously, you could teach hours and hours on endurance. I'd be happy to talk about other energy systems. But if you have any requests, if you have any questions as it relates to exercise, movement, mobility, oxygenation of tissue, anything we talked about today, make sure that you reach out to us, ask us through Facebook, or you can contact us directly with any of the links that are associated with this podcast. So thank you very much for tuning in, and we look forward to checking in with you next time. We'll see you soon. Thanks for joining us today on True Health Solutions Podcast. Make sure that you click to subscribe. Also, go to our website, www.truehealthcharlotte.com, where you can download any resources related to today's show or any future shows. And lastly, if you search for True Health Center Group on Facebook, you'll be able to join our free health community. We look forward to seeing you there.